It's important to take preventative measures for your health to catch diseases before they become a problem. Dr. Eric Stanek, Chief Medical Officer of DoctorsNow, is here to share why primary care is a crucial part of preventative medicine, because we really need to stay on top of things right before they become a problem.
Yeah, well, talking about, people use terms like preventative medicine, health and wellness. A lot of people are referring to the same thing. And like Irene said on the segment before, the best preventative medicine is maintaining your physical activity, making sure your cardiorespiratory fitness is good, making sure your strength is good. These are the two most important things for living longer and living better. But on top of that, coming in, having making sure you're getting your annual wellness screening in so that we can talk about things like heart disease and cancer. These are two things that have identifiable risk factors. They can be detected early, and they can get worse over time if they're not addressed early. So it's important to come in and get these things taken care of. Because
you all will do tests and run numbers for us, like cholesterol, blood pressure, things like that. Is that something that's good to know and really sort of track?
Yeah, it's important to know them early, because they can compound over time and cause disease or cause cancer to build up if they're not detected early. So generally, when you go in for your annual wellness screening, we're looking at things like liver function, kidney function, electrolytes, blood sugar, cholesterol, triglycerides. We're not just doing them for no reason. There's an important reason, and that's because these things are risk factors for both heart disease and cancer over time. Sometimes people live very healthy lives, but they have a genetic predisposition towards these things, and we can find those things early.
A lot of screenings too, as far as mammograms, other tests like that to do.
Yeah, cancer screenings are an important part of your annual physical. So the guidelines have become more aggressive in the last 5 to 10 years or so. Take colon cancer screening as an example. We used to say you could come in for your annual screening around the age of 50. Well, that's been moved up to the age of 40 by most organizations now. And colon cancer screening can be done by a couple of ways. There's some people who are hesitant to go in and get a colonoscopy done. It's completely understandable. I think the most important thing for people to know is that is the gold standard for cancer screening. We can do direct visualization of the colonic mucosa and see if there's any polyps or anything that's potentially concerning for cancer. But for people who don't want to do that, there's an alternative, which is a stool test called a Cologuard, which can look for blood that can't be seen by the naked eye, or some DNA changes that may be indicative of cancer. And that's something that people can do as a first step if they're hesitant to have a colonoscopy done. Mammograms for breast cancer screening, those have become more aggressive lately too. We recommend that most women have mammograms done at the age of 40 and then do it annually or at least once every 2 years at minimum. The lifetime breast cancer risk for all women in the population is over 10%. It's around 11%. So getting your mammograms done, and if anything does pop up, they can get treated while they're still local to the breast tissue. Once cancer starts to invade the lymphatic system or the blood vessels and go to other parts of the body, that's when it becomes very difficult to control and can potentially become fatal for people.
Yes, you really want to catch it early. And is that why having a primary care physician helps too, because you can kind of keep track of all of this and keep us on track for when we need to get these screenings?
Yeah, because your primary care doctor will always know what the guidelines say, and they also know you personally.
And your health history.
And they know your health history, and they know your family history as well. Not everybody's risk is the same, so it's really important for people to have a primary care doctor that they can hold each other accountable, and have a family doctor who knows you well, so that they can make sure that all of these things are being taken care of, so that you can live a long, healthy life.
And of course, you have the direct primary care, so people can take advantage of that to really make sure they're staying on track too.
Yeah, so we prioritize access a lot at DoctorsNow. We care a lot about preventative health and wellness, all of those things. And some people have a hard time getting in with their primary doctor. Sometimes it can take 2 to 3 months to be seen. They don't get a whole lot of time with people. We offer a program called Direct Primary Care that's subscription-based. It's $89 a month, and we're absolutely able to get people in to take a look at their blood work and talk through cancer screening and stuff like that. We also take people's insurance, so if people want to use insurance, they can use that as well. But for people who don't want to use their insurance or don't have health insurance, we have options for them. Insurance shouldn't have to be a prerequisite for people to have primary care. So we try to meet people where they're at.
Well, Dr. Eric, thanks so much for sharing this. And PSA, the colonoscopy isn't that bad, so people should just go get best nap of your life.
Absolutely.
Thanks for being here.
Thank you.
Well, to learn more, go to doctorsnow.com or call 515-270-1000. They have locations in Altoona, Johnston, and West Des Moines, and you can see more on social media.